My role specifically is to work with people living with dementia and their families to help them select digital technologies or citizens technologies that can support their condition, support their independence and support their well-being. So, and by digital technologies, we tend to mean the things that you and I might already have or might go online to buy. So things like tablets, smartphones, smart speakers and things of that kind. Really and truly, when people are living with dementia or living with a dementia diagnosis, early intervention has the biggest impact. Because what we're trying to do is introduce technologies that will support people throughout their dementia journey, and also introduce technologies at a stage where the person can learn new skills to manage the technology if they need to. It becomes part of their everyday routine and therefore is more likely to be used as their condition progresses. And it also means that the person living with dementia has a much higher element of consumer choice. In other words, they're choosing technologies that really suit them and fulfill their needs, rather than their families perhaps doing it on their behalf at a later stage in their condition. I think the main challenge still is connectivity to the internet. It is a barrier for families on lower incomes, and obviously digital technologies do tend to require a very good internet connection for them to work. That cost has to be ameliorated somehow, and I think unless we can get to a stage where people living with long-term conditions either have free or vastly reduced cost of internet connections, then that will always be a barrier and limit services like mine. I think at the moment, how I perceive my service and how it seems to be being used is by families of people living with dementia, so that they can continue to provide remote care, whether by geography because they live a long way away or because of their life circumstances, they're very busy. So digital technologies in the main are used to support remote care of people living with dementia, but that means that that family can then delay having to go to statutory services to request care. So there's maybe a delay in having to go and ask for a package of care for their loved one. And I think that provides a model for working in social and telecare situations. There are things that can be done, such as medication prompts, monitoring of people's condition, well-being visits can all be done using drop-in video technologies, for example, and that could reduce some pressure on care services. Families, I think, perceive a service such as mine as bespoke and more personalised, rather than working with larger organisations, you know, if they're going to the council or they're going to a telecare provider. So because I work one-to-one with families from the start, it gives them more of a sense that their loved one is cared about rather than taken care of. Make sure that they understand that the most important thing is the person and not the technology. The technology is there to suit the person and not the other way around. So I would advise anybody setting up the service to try not to bury it under lots of layers within a larger service. Make it upfront and as easy to access as possible, and don't underestimate demand, because if you have a service like this, then you will get plenty of people knocking on your door looking for your support. And for example, I've supported twice the number of people that I was expected to by this stage of this project. So yeah, it's a very high demand service if you're able to provide one. Don't try and shoehorn the role into the remit of already very hard pressed staff. In time, digital support will become part of everybody's role across the care sector and in every care setting. But at this time, the role is still a specialist one. Make sure you have somebody who's got the confidence in the condition and the technologies to take the role on. The thing about it being a specialist role isn't about it being somebody with loads of qualifications. It's just getting somebody who's got that combination of understanding the technology and understanding the people. And those people exist, but they perhaps don't think they exist.